Welcome to The Explainer. Today, we're putting on our detective hats. We're going to dive deep into the mind of a physical therapist to uncover the incredible thought process they use to solve the unique puzzle that is your pain. So, how do they actually do it? Is it some kind of magic intuition? Well, not exactly. It's a structured, almost detective-like investigation called clinical reasoning. And believe it or not, it starts the very moment you walk through the door. So here's how we're going to break it all down. We'll start by looking at the clinician as a detective, then we'll see how they gather those first crucial clues, how they test their theories, and finally how a total novice grows into a master of their craft. Okay, first things first. You have to understand that the goal isn't always about finding one single definitive culprit for your pain. The reality is often way more nuanced than that, just like in a really complex detective case. Instead, the real mission is to answer a much more immediate and powerful question. Can we change what you're feeling, make it better, maybe even a little worse, right here, right now, just by using specific movements or pressures? Is it modifiable? For you, the patient, this is a total game changer. It takes the focus off some scary, permanent diagnosis and puts it on finding a changeable problem we can start working on today. All right, so where does this whole investigation even begin? Well, the process of gathering clues actually starts long before any hands-on tests are performed. It kicks off with simple but really powerful observation. Just picture it. You're sitting in the waiting room, a really sharp clinician is already taking mental notes. Are you pacing around or are you sitting perfectly still? Did you pick a hard, upright chair or sink into the low couch? Do you need to use your arms to push yourself up? Every single one of these is a tiny clue that starts to paint a picture of what makes your symptoms better or worse. And all these little clues help the therapist establish something we call symptom irritability. Now, this isn't just about how much pain you're in. It's about what it takes to stir it up. And maybe more importantly, how long it takes for things to calm back down. Understanding this is huge for you because it means the therapist knows how much they can safely test you without causing a big flare-up. Okay, so once they've gathered these initial clues, it's time to fire up the real engine of clinical reasoning, the hypothesis testing loop. This is where the detective work really gets going. The number one tool in their toolkit here is something called symptom modification. This is a really active process. The therapist forms a quick hypothesis, a best guess, like, I bet if I do this, it'll change their pain. And then boom, they test it immediately. Does that movement or that pressure make your main symptom better, worse, or does nothing happen at all? But this isn't just random guesswork. It's guided by a simple but really elegant model. Why, where, and how. They're constantly trying to narrow it down. Why are you having this pain? Is it more nerve, muscle, or joint? Where is the main driver located? And how can we best use our hands or a movement to change it for the better? And this brings us to a really important point. This whole process, it's not about slapping a permanent label on you. It's a probabilistic determination, a best guess of what's most likely the issue right now. And this should give you so much hope because it means the diagnosis can actually evolve and change as you get better. You are not stuck. But how does a therapist actually get good at this? Because let me tell you, the way a brand new physical therapist thinks is a world away from someone who's been doing this for 20 years. It's all about this journey from thinking slow to thinking fast. I mean, the contrast is pretty stark. A novice clinician runs on what's called type 2 processing. It's analytical, it's slow, it's very deliberate. It's kind of like when you first learn to drive, right? You're consciously thinking about every single step. An expert, though, they're using type 1 processing. It's intuitive. They've seen this pattern 1,000 times before, so they make these quick, almost snap judgments that are perfectly tailored to you. So what's the secret sauce? How do you get from that clunky novice stage to that smooth expert intuition? Well, it all boils down to one incredibly powerful skill, metacognition. It literally means thinking about your thinking. And here is the absolute key difference. A novice usually reflects on action. After the session is over, they think back, what went wrong? What should I have done? An expert has mastered reflection in action. They can recognize in the middle of the session that their hypothesis is wrong and pivot their entire plan on the fly. It's like they're adjusting the flight plan mid-air. Of course, getting to that expert level means being brutally honest with yourself about where you can go wrong. It means knowing your knowledge gaps, spotting flaws in how you gather information, and most importantly, being aware of your own cognitive biases that can lead you down the completely wrong path. So it's one thing to be aware of these potential traps, but how do you actually build the skills to avoid them? Well, that brings us to the final piece of our puzzle: how this incredibly complex skill is passed on to the next generation, usually through mentorship. And this is done through a really amazing hands-on process. A great mentor won't just give you the answer. No way. First, they make the student commit to their own hypothesis. Then they probe to understand the thinking behind it. They teach general principles to fill in any knowledge gaps, reinforce what the student did well, and then gently correct any mistakes. This whole process takes that expert's silent, intuitive thinking and makes it loud and learnable. And really, this whole journey, from novice to expert, from observation to treatment, it all comes back to one core truth, and it's captured perfectly in this quote from the legendary therapist Jeff Maitland. In the end, all the theories and all the models have to serve the person in front of you. If your theory doesn't fit the patient's story, you don't question the patient, you question your theory. Because in the world of the diagnostic detective, the patient's presentation is always the undeniable truth.